Do you have any idea how many people will die every day globally this year, 2023? According to the research, there will be 166,324 deaths daily, which means 6,930 every hour, 116 per minute, or at least 2 deaths per second. Now, let us see what the 5 leading causes of death among adults are. Number 5. Alzheimer's disease. Alzheimer's disease is a condition that worsens over time and impairs memory and other vital mental abilities. Memory and other crucial mental abilities eventually become lost as brain cell connections and the cells themselves age and die. Age-related changes in the brain, as well as genetic, environmental, and lifestyle variables are likely contributing factors, depending on the individual. Each of these characteristics may play a different role in elevating or lowering the risk of developing Alzheimer's disease. Person with Alzheimer's may go through cognitive decline, difficulty understanding and thinking, confusion at night, delusion, disorientation, forgetfulness, making up things, mental confusion, difficulty concentrating, inability to form new memories, inability to perform basic math, or inability to identify everyday objects. Research has demonstrated that there are steps we may take to lower our risk of acquiring Alzheimer's, even if there are currently no clear-cut solutions for its prevention. Reduce your risk of developing Alzheimer's disease by managing your blood pressure, control blood sugar, keep a healthy weight, be active physically, give up smoking, stay away from binge drinking, get enough sleep, and prevent and treat hearing loss. Number 4. Cancer. Cancer develops when DNA damage prompts the body to produce aberrant cells that are unnecessary. Cancer can develop practically everywhere in the body. The cancer cells may eventually move to other parts of the body, where they will start to grow there as well. There are more than 100 different kinds of cancer, the most common of which is lung cancer. Depending on the type, cancer symptoms can change. They may include lumps or thickening of the skin, bladder changes, such as difficulty urinating or pain or bleeding when urinating, bowel changes, such as changes in bowel habits or blood in the stools, extreme and persistent fatigue, difficulties eating, such as pain after eating, difficulty swallowing, nausea and vomiting, night sweats or fever, and skin changes such as moles, freckles, warts, sores that do not heal, easy bruising, or changes in skin color, and unexplained weight gain or weight loss. Some ways to prevent cancer are: avoid smoking, maintain a healthy weight, engage in regular exercise, consume a nutritious diet, and, if you do drink alcohol, do so in moderation. Take steps to avoid infections, avoid the sun, and schedule frequent screening exams. Number 3. Lower respiratory infection. Lower respiratory tract infections include influenza, whooping cough, acute bronchitis, bronchiolitis, pneumonia, and other illnesses that damage the airways. They constitute one of the main causes of disease and mortality worldwide. Many different microorganisms, such as bacteria, viruses, and fungus, can cause lower respiratory infections. The common cold or the flu can frequently coexist with a lower respiratory infection. People who smoke, children under the age of 18, adults over 65. Those with respiratory illnesses, those with weaker immune systems, including those with HIV, and those who have just undergone major surgery are those who are most at risk. The doctor may request a variety of tests, including a chest X-ray, sputum test, computed tomography CT scan, bronchoscopy, arterial blood gas analysis, pulse oximetry, pleural fluid culture, and others. Some steps to prevent lower respiratory infections include: get all the necessary shots, such as the yearly flu shot. Regular hand washing is important, especially after being in a public area. To avoid introducing bacteria into your system, refrain from touching your face. Consume a diet full of vitamins and minerals. Routinely get 7 or more hours of sleep each night to lower your stress levels. Engage in regular exercise and meditation. Second leading cause of death worldwide is CVA or stroke. According to the American Stroke Association, stroke is a condition that affects the arteries that provide blood to the brain and its surrounding areas. Numbness or weakness in the face, arm, or leg that typically only affects one side of the body, confusion, difficulty speaking or understanding people, vision issues, dizziness, issues with balance or coordination, and a severe headache are some of the symptoms that appear rapidly. Identified risk factors are non-healthy lifestyle and use of illicit substances like cocaine and methamphetamine. Next is medical risk factors like high blood pressure, cigarette smoking, diabetes, and irregular heart rhythms like atrial fibrillation. Other factors associated with a higher risk of stroke include age, race, sex, and hormones. Things to do when someone is having a stroke: call 911 immediately. Note the time you first see symptoms, as this is important to determine what treatment is necessary. Perform CPR if necessary. Thrombectomy is advised in suitable individuals 6 to 16 hours following a stroke, according to the latest American Heart Association recommendations. They also broaden the list of those who qualify by permitting patients who are ineligible for TPA to receive mechanical thrombectomy within 6 hours. Important steps to prevent stroke are: choose healthy foods and drinks, keep a healthy weight, get regular physical activity, don't smoke, limit alcohol, check cholesterol, control blood pressure, control diabetes, treat heart disease, take your medicine, and regular appointment with your doctor. And the #1 killer is heart disease. Heart disease comes in numerous forms, and as a whole, it is the leading cause of death worldwide. It takes place when the coronary arteries, which deliver blood to the heart, constrict or are clogged. Everybody has a different set of symptoms. Others may experience shortness of breath, especially when exerting yourself, pressure, squeezing, burning, or tightness in the chest, cold sweats, wooziness, nausea, or indigestion, discomfort in the neck, shoulder, or arm, and weakness. If you have any of these signs, you should see a doctor, preferably a cardiologist. Regular exercise, a healthy diet, and weight management are all important components of prevention. Thank you for watching. See you again on my next video. Please like and share. And don't forget to subscribe.